Today, unfortunately, we're here to report the death of a 1-month-old infant from pertussis, otherwise known as whooping cough. This is the first death from whooping cough in the County of San Diego this year, and the first death reported by the County of San Diego since 2001. This unfortunately follows the death of 6 other infants in other parts of California from whooping cough this year, in what has been an epidemic year for pertussis or whooping cough in the state of California. We continue to see increased number of cases of whooping cough across San Diego County, with 266 cases being reported to date, with many hospitalizations, particularly among infants younger than 6 months old. This death follows on recent recommendations from the California Department of Public Health to increase outreach and vaccination efforts for populations in California most affected by pertussis, including our caregivers and parents of infants younger than 6 months or too young to be immunized themselves. So we'd like to unfortunately use this tragic event for this family and the community members who knew this family to remind folks that this is a preventable disease, and we all have our part in working to assure that we are vaccinated ourselves, our children are vaccinated, and that our healthcare providers are offering vaccine to their patients.
And unfortunately, this case is a tragic example of what can happen with whooping cough or pertussis. Young babies are the most susceptible to severe disease with whooping cough. Part of that has to do with their immaturity, both in terms of their immune system, but also their hearts and lungs. But it also has to do with the fact that we cannot fully immunize a young baby. It takes 3 doses of vaccine to provide the best protection to infants, and that takes 4 to 6 months of age to accomplish. So babies in the first few months of life can only be protected if we protect those around them, their family members, from getting pertussis or the whooping cough. And what we've learned about this infection in the last 10 years or so is that many older children and adults get whooping cough. Unlike many childhood diseases, this disease affects people of all ages. Fortunately, we now have a vaccine that can not only prevent infection in babies, but a version of that vaccine that's effective in older children and adults. It's called Tdap, T-D-A-P. It is recommended for everybody up to 64 years of age. It is particularly recommended for family members in households where there are young infants. When a newborn comes home, our goal is to have their whole family protected against whooping cough before they come home. That means their mothers, their fathers, their brothers, their sisters, and even their grandparents should all be immunized against this infection to prevent tragedies like the one that we're talking about here today. So I think the most important message for the community is to know that there is a way to prevent whooping cough, that the vaccine is widely available. It's recommended for everyone up to 64 years of age, and I'd encourage people to check their immunization records, and if in doubt, check with their physician to see if they're in need of this vaccine.